I believe so. It is Wednesday, March 31st, 2021, 5:30 p.m. And we are now commencing the Board of Managers meeting. The first item of business is public communication. Do we have, Anise, do we have members of the public who have signed up for public communication this evening?
We do. We have two. So I'm going to start by reading the instructions before we dive in. To be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail by 90 minutes prior to the start of the meeting. Individuals are asked their preferred language as they register to speak, and both the online form and voicemail greeting are in English and in Spanish. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when each speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Once again, speakers will be muted at 3.5 minutes to ensure the efficiency of the meeting. Due to the restrictions of the Opens Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. So with that, I will call on Rachel Blair with HAM.
Good evening. My name is Rachel Blair. It's good to see y'all again. Wanted to say again that we're very grateful to Central Health, the Board of Managers, and to staff for your time tonight and for the success of our longstanding partnership. I wanted to provide a brief overview of what was submitted to Central Health staff in an effort to outline the specifics of our initiatives and our proposal. We'll be doing outreach. We will be doing outreach and navigation related to the 2021 special enrollment period for the new Central Health Premium Assistance participants, including paid and earned media campaigns, partnership development, and with community organizations, spokesperson engagement promoting the benefits of the ACA and healthcare coverage, as well as informational interactive sessions. The section relating to the Affordable Care Act plan updates, which frees up premium assistance through increased tax credits, would include the coordination and execution of communication plans to reach over 1,056 program participants, and that would facilitate the ACA plan updates, coordination with community partners, and ongoing data collection and evaluation. The new enrollments that work would also include facilitation of enrollments for new program participants in the Central Health Premium Assistance Program. That is a very high level and quick overview of a lot of work, but just wanted to try to hit those big buckets. So when the time is right, we're here to answer any questions on the action item, and wanted to again reiterate the gratitude for our work together. We have such a strong partnership between Central Health, Sendero Health Plans, and HAM, and it makes all the difference in the world for our low-income Travis County musicians. Thank you again.
Thank you. Anise?
Thank you. Next speaker and final speaker this evening is Cynthia Valadez with Central Health Board of Managers.
Wonderful, please.
Thank you. Thank you all for having me today. And my comments will be short because there are several issues on our agenda today that relate to the theme of healthcare planning and implementation. I thought I'd like to connect some of the dots as I see them. I want to applaud the staff and their willingness to adapt to responses to the community healthcare needs during this pandemic with flexible and thoughtful approaches and solutions. I also like to reinforce Central Health priorities during this pandemic. That is to ensure service delivery to our most vulnerable. And that to me means more shots in the arms, taking advantage of President Biden's expansion of the ACA marketplace, and doing everything that we possibly can to reach Travis County's over 176,000 persons living in poverty that don't have access to health care. They don't have insurance, comprehensive health care insurance. I appreciate the need to develop new ways of designing healthcare, but my preference is that before we get too focused on on changing our system, first I'd like for us to review the current system as it exists. As you know, we have our healthcare facilitators as Sendero, the CCC, and community care that have helped us with our great needs right now and that require our attention. These are our boots on the ground. Moreover, past efforts at system reform, such as Central Health's integrated healthcare system, needs a thorough review and discussion, at least of what worked and what didn't, so that we as a board may know how to benefit from that information lost, or gained rather. We've spent millions of dollars on the integrated healthcare system, and we should understand the bottom line results before we embark on another healthcare system reform and redesign, although I am in favor of that. My request is also to redouble our attention and focus on the current pandemic, making sure that we are taking care of the service delivery arms of Central Health, and that is Sendero, community care, and the CCC. And also to please get a definitive reading on our past healthcare redesigns before we start down a new road. Even though I do believe it's necessary and the need to look at a new healthcare system with an eye on equity is uppermost in my mind. Thank you very much.
Thank you. Anais, do we have any other participants as far as public communication?
We do not. That concludes public communication for this evening.
Thank you so much. We will now proceed to the consent agenda. Consent agenda. C1, receive the quarterly investment report and ratify Central Health investments for February 2021. C2, approve the minutes of the Central Health Board of Managers February 24th, 2021 meeting. Is there a motion? Manager Valadez.
Yes, I move that we approve the minutes for the February 24th meeting.
Thank you. And I think I saw a second. Is it Manager Brinson? Yes, there's a second, a motion by Manager Valadez and a second by Manager Brinson. All in favor? Aye. Aye. Okay. Opposed, same sign. And I'm looking carefully. Any abstentions? Any abstentions? I'm not seeing any abstentions. All right. So thank you, members. The motion passes. Managers, on our regular agenda this evening, we will not be considering item 5. That item was discuss and take appropriate action on a request by community care regarding compensation for certain new hires. We will now move to our regular agenda. Item number 1, receive an update from the CEO of Episcopal Health Foundation about a grant to support Central Health's fiscal year FY 2021 board priority objective to develop an equity-focused strategic system of care plan. Monica Crowley, Mike Gieslin, and Elena Marks of Episcopal Health Foundation will be presenting, and thank you for being here with us this evening.
Thank you. Madam Chair, I'll kick it off and then hand it over to Monica. Members, you'll recall from prior discussions before the Strategic Planning Committee in January that whenever Monica and team were discussing the systems based through equity lens of work, that there would be an effort to seek philanthropic funding to support the work that's necessary to advance us to the next level. So we're back here today to discuss that philanthropic support. This is an informational item, and there's not going to be any action requested tonight, and perhaps not even for probably another couple of months. That way there's plenty of time to digest the issue, but this is great news, and this is a big step for us. As you're thinking about this as board members in terms of alignment, the Episcopal Health Foundation, based out of Houston, has an area that stretches west and picks up Travis and surrounding counties. And we're fortunate because this grant will allow us to engage a consultant using our procurement processes to be able to do the necessary evaluations, analysis, and study, again, to take us to the next level. And knowing and understanding and having the opportunity to work with Episcopal Health Foundation and their commitment to health equity, but also looking through a health equity lens, Manager Valdez, as you stated, for planning and strong health systems for the benefit of our underserved and our low-income populations that we are privileged to serve. And so with that, I will turn it over to Monica.
Thank you, Monica.
Thank you, Mike. And thank you, Elena, for joining us here today. Elena is going to introduce the Episcopal Health Foundation, but we are very honored to have Elena with us today. And she is the president and CEO of the Episcopal Health Foundation. And she's also an attorney who has served as the director for health and environmental policy for the city of Houston. She serves on the board of Grantmakers in Health, the largest national organization serving the field of health philanthropy, on the board of Harris Health System, and on the board of Community Health Choice, Houston's community-based health insurance company that has more than 400,000 members. Elena, thank you so much for joining us here tonight. I'm just thrilled about this presentation to support work that Central Health has never taken on before in a leadership role for this community. So thank you.
Thank you so much. As Manager Valadez said, we are so committed to equity. And Elena, thank you for being here. I honestly don't know how you have the time, so thank you for taking the time to be with us this evening.
Well, thanks very much. So I have to tell you that the honor is mine. We do our work by supporting groups that do the work on the ground. I sometimes say we sit in an office in downtown Houston. We don't actually serve people. And we accomplish our mission when groups like Central Health are doing the work that needs to be done in the community. So it is our honor and privilege to be able to support this organization in doing such an important fundamental job. I'll give you just a quick overview of who we are. We are based in Houston, but we cover 57 counties, and we do pick up the Austin area. We are, some people call us a hospital conversion foundation. We are the product of the sale of a hospital system. Unlike in the case of St. David's, ours was a complete conversion. So we have no relationship with the hospital or with anyone else. We are completely independent, and it gives us a lot of flexibility, which is really nice, not to be tied to any particular player in the sector. Our operating budget for this year is $56 million. There are 30 of us. We are mostly people with degrees in public health, public policy, and business. We have a bunch of LBJ graduates. We take a systems upstream approach. We use the hashtag health, not just healthcare, because we think that the ultimate goal of healthcare is really to improve health. And we think that working at a systems level and as far upstream as possible is the best approach to actually improving health outcomes, particularly for low-income and vulnerable populations. We work in partnership with lots of other organizations, including a lot of other funders. We co-fund with St. David's frequently, with Michael and Susan Dell as well, and with other foundations across the state and the country. And we really try to leverage our work. We do a lot of work with governmental entities, because when governmental entities do their job well, it affects way more people than we will ever be able to affect as Episcopal Health Foundation. We spend a lot of time working with Texas Medicaid and with local governments, because when you all do well, we do well. We do grant making. Most of our money goes out the door in the form of grants. We also do a lot of capacity building work. We have we fund grants to do capacity building, but we also have people within our organization who will help organizations with capacity building efforts. We have a research and evaluation team in-house. Our lead from there is a PhD from the LBJ School. And we use our research both to help us know what it is we ought to be doing, and also to produce independent data that local organizations can use. If you're not used to living in a census data set, we can translate that information so that it's useful to you. And we do a lot of engagement work. We do it through our churches and through all sorts of organizations where we provide direct service, or we fund community organizers, we fund leadership training groups, and we really have a holistic view of, if we want to improve the health outcomes, we need to improve and reform the healthcare delivery system so that it's actually delivering health, and we need to make sure that the populations most affected are engaged in the process, that it's not a one-way street, that communities are letting the powers that be know what they want and need. We do a lot of funding in Travis County. I pulled our data for the last 3 years, and we had a little more than $20 million in grants to organizations within Travis County. We have $3.5 million with Lone Star Circle of Care, which I know is more than Harris County. We have $2.7 million with Dell Medical School, $2 million with El Buen, which of course is part of the church, $1.6 million with community care, $1.6 million with integral care, and $1.4 million with Peoples. And so that's just to tell you, we may not live in Austin, but you are part of us, and we are part of you. Really delighted to have this opportunity to support this planning effort. We've been in conversations with your excellent staff for a while, who, in following up on the work that you all have been doing for a while, brought this to us, and we've had great conversations. This aligns perfectly with EHF's work. You could not come up with a better item for us to support, because we think that the approach you're taking is the right one, that it's holistic, that it'll be data-driven, and it'll be equity-focused. And we want to make sure that you're well-resourced to do the work. So this is an easy one for us. We are delighted to see you doing this work, and we want to make it possible. And as Monica said in the introduction, I sit on the Harris Health Board. We just finished a round of strategic planning, so I know where you sit. It's scary and it's fun, but it's your job, and I'm so glad you're going to do it. And thank you for allowing us to be a part of it by supporting the effort.
Thank you. Thank you for all that you do for our community here in Travis County, and for collaborating with us at Central Health. We really appreciate it. Monica?
That's all. I think when so right now we have put a request for proposals on the street for consulting services that will assist staff with community needs assessments, community engagement, and stakeholder engagement, and help support this planning effort that's going to be undertaken in the strategic planning committee for the rest of this fiscal year. And when we have determined the consultant that we're going to engage, we'll be bringing back an action item to the board we're going to propose that you formally accept this grant, which I think, David, is one of the requirements for a hospital district to actually accept a grant, is that the board accepts it. And we think we'll be bringing that back to the board in May or June.
Thank you for keeping us updated, and for all of the hard work. We certainly want to be very comprehensive in our approach to equity in our strategic planning, and as we move forward, as Manager Valadez stated. And Elena, thank you so much for being here with us this evening, and we look forward to further updates. And Monica, we look forward to the results of the request for proposal that Central Health has out right now, correct? Thank you. All right, anything? There's no motion necessary, members. Anything else on this item before I move on to our second item? Manager Musaitif, did you have something?
Yes, mine is really a short comment. Thank you, Ms. Marks, for being here. I'm always delighted when I see you. I appreciate the work that you have done in our county and beyond, and we are looking forward with this collaboration that will improve the health of our community and most vulnerable. Thank you.
Thank you. Anything else, members? Yes, Manager Valadez. Yes.
Just a side note, we have an RFP right now in place with Central Health for outreach. I'd like to know exactly where that is and how people, outside entities and other nonprofit organizations or for-profit organizations can find it.
Okay. I'm not sure.
Other than subscribing to a particular service.
Right. I need to look at my council now, David. I'm not sure if we can address that under this particular item the way it is on the agenda.
I'm trying to decide, is the question about, oh, Mike, please.
Yes, I can enlighten this. Manager Valdez had made that request of me earlier today, and I apologize, Manager Valdez, I haven't fulfilled it yet.
Okay.
It's just, the focus has been on some other things, but I do have it on my list of things to do.
Thank you. Okay. Thank you.
That. So I'll wait for an offline response. But
Exactly.
I would just like to state that when we do have RFPs in place, let's please expand it to our website also, and not just in one particular subscribed place. Thank you.
Thank you. We'll continue this discussion offline with more information from Mr. Giesel. Appreciate it. Thank you. Okay, managers, I'm not seeing anything else. And if not, again, thank you to Episcopal Health and to Elena Marks for being with us here this evening, and to all the hard work that she and her staff and our staff are putting into this to have the most comprehensive approach we can to equity. Thank you. Right, managers, we will now move to item number 2 on the agenda, receive a report on fiscal year-to-date healthcare service expenditures made by and accept the preliminary February 2020 financial statements for Central Health and the Community Care Collaborative, including fiscal and related operational updates for Community Care Health Centers and Sendero Health Plans, Inc. Mike Giesel will open the item and Lisa Owens will be presenting. Thank you, Mr. Giesel.
Yes, thank you, Madam Chair. Members, before I hand it over to Lisa to cover the financial reports for Central Health, I wanted to point out that in your packet you have financial summaries and some key highlights for CUC and Community Care and Sendero. We're trying to catch up on some quarterly highlight reporting items that we owed, and just because of some of the compressed agendas following the weather issue, we're trying to get back on track. And so what we'll do is when we have the true quarterly ending, meaning after the first month after the last month of the quarter, we'll get back on track in terms of providing this information. But I just wanted to draw your attention to it in the packet.
Thank you very much. We'll now turn it over to Lisa Owens.
Okay, thank you.
Okay, I'm going to try to share the presentation again. I'm not sure if I got that right. Okay, good evening. Lisa Owens, Deputy CFO. Good to see you all. All right, now, can you see the PDF?
Yes, looking good, looking good.
Sorry, it's hard to drive and talk at the same time, right?
It is indeed.
Thank you for letting me be hands-free. So I am going to just hit the highlights of our presentation tonight. I am not going to go through all of the detailed slides, as we have talked about trying to make sure that you have the most important information, but the financials were shared with you in the packet, and staff is available if you have specific questions as you go through, and hopefully you had a chance to review them. So I'm also happy to answer any questions after I go through them. So we do have some highlights. I will just go through the balance sheet and talk a little bit about some of those highlights that were on that highlights page, that we continue to have a strong cash position. Our current assets are at $388 million, and we continue to have relatively low current liabilities at just $21.8 million. So a very important thing to kind of just make sure we continue to talk about on the balance sheet that you will see next month is we have discussed the impairment of the hospital tower. You will see we have total capital assets of 112 million on our books. Significant portion of that is the hospital tower. So next month, in the month of March, we will be impairing that, and you will see a significant drop in those assets, about $50-ish million. That is a balance sheet item. It does not impact our cash position. So I just want to make sure that you know and don't have any surprises next month. We've been talking about that for a while. But,
Thank you.
that tower is, the demolition is well underway, and the impairment is being recognized. On the sources and uses, I would just highlight that we had our February strong tax revenue collection. With the way the end of the month fell in January, we had quite a few dollars come in February. We will start to see that decline over the remainder of the fiscal year. And we are at budget. And I wanted to highlight something. I think we talked about this several months ago, but the end of the budgeting process is conducted based on the certified roll. And the certified roll is received in the summer. And by the end of the certification and the final Travis Central Appraisal District certification that early, and the timing of the final roll, there was about a $5.2 billion change in those dollars. And as a result, we are going to see over budget in tax revenue of about $5 million. So we will continue to see some funds come in tax revenue throughout the next few months. It's slower. It's much smaller amounts, you'll remember, towards the summer. But we will anticipate to be having a few more $1 million coming in tax revenue. Other than that, we did not have any significant healthcare program or administrative program transactions. Our operations continue to be steady. We had some planned new initiatives with our call center and some case management investments that you learned about last year in the budget. Everything is on track and well underway. And I don't have any additional significant transactions to report other than the ongoing implementation of our programs. So I will go now to the CCC financial reports.
Thank you.
Oh, and I just closed them. Sorry about that. One moment.
Oh, Zoom land.
I know, sorry about that.
No, we all deal with it. No worries.
What I can tell you is same thing with the CCC. As you know, the CCC, here we go.
You're good.
Primarily funds our healthcare services that are budgeted in the CCC and our DSRIP program. Our cash position is about $3 million ahead of last year at this time. We have very, again, our liabilities are primarily in healthcare, and we have our behavioral health program, a little bit of specialty care in the CCC, as well as the DSRIP program. We started the year with that contingency reserve carry forward, about $3 million ahead of last year, and that carries forward into the month end February. And no other significant impacts to this organization or the programs, with the highlight just being that you'll recall the source of funding, the sources that are in the CCC are the DSRIP revenue, which does not come into the organization until July. So similar to last year, we will not see that source of funds until later in the fiscal year. And we continue to monitor the DSRIP program and continue to see successful outcomes from our partners. And again, there is additional details on the healthcare delivery programs in the packet. So with that, those highlights, I will gladly answer any questions if I can, or take them back and get back to you.
Hey, do we have any questions at this time? I am scanning. Members, speak up if you have any. I'm trying to scan for any, but I'm not seeing any at this point. So if there are no questions, there's no motion necessary on this item, on agenda item number 2. And if I don't hear anybody shout out, I'm not seeing any questions, then we will move on to agenda item number 3, members. Yes, Manager Valadez.
Thank you for recognizing me, Madam Chair. I'd like to know, since we have the ham people here that spoke in public communication, I'd like to know whether or not we can move their item up so we can have a discussion of it before it's 11 o'clock at night. Hopefully not, but still.
Well, hopefully it's not going to be 11 o'clock at night. I think we're running our meetings more efficiently. And actually, item 11 was purposely placed where it is on the agenda in order to recognize 2 things. One, the information that will be presented in item 10 regarding Sendero is in closed session and may inform the board and help with the discussion on agenda item 11. And we're trying, to the benefit of all those who are watching and all those people we schedule, not to be going in and out of closed session. That's very time consuming. And as such, item 10 needs to be before item 11. Second, as I said, we have outside presenters lined up who were already scheduled on a slate of items and that are going to be considered in closed session. So
I appreciate that.
I understand. So let's just be as efficient as we can and move through things in an effective and efficient manner. And
I appreciate that, Madam Chair. I just would like for you to consider the fact that we have done this in the past, and if we have people scheduled that are scheduled to speak, and we have speakers that have spoken, it would be nice to accommodate them, not only for certain people, but for all people. Thank you very much.
I understand. We do our best, but given where we thought that some things need to be in closed session and that some things that need to be heard and discussed before this, we don't have much option.
I understand. Thank you.
Thank you. Appreciate it. And appreciate everybody who was present, whether you're a resident, a member of the community participating, or those who are scheduled to speak. We want to be respectful of your time while having the discussion we need to, and we'll do our best. So thank you. Okay, so at this time, we're going to move to agenda item number 3, receive and discuss a report on historically underutilized businesses, HUB, open paren, close paren, spending performance for fiscal year 2020. Belena Bunch and Lisa Owens will be presenting.
Okay, good evening, I'm back. Lisa Owens, Deputy CFO, can you see my screen?
Yes, we can. Okay. Thank you.
Great. Wonderful. So very excited to be here this evening and be joined by my colleague, Belena Bunch, our procurement manager. We are going to present our fiscal year 2020 historically underutilized business report. The report this evening does share an overview of the expenditures that Central Health had with minority and women-owned businesses who have obtained their HUB certification. So I will go through a few slides and then turn it over to Belena. Our current purchasing policy states that Central Health will make a good faith effort to engage HUB vendors, as we do not currently have a formal HUB program. We also request that all of our contracted vendors make the same effort if their work involves engaging subcontractors. So the good faith effort that we undertake is significant outreach. We do that to find HUB contractors for solicitations that we issue, and also encourage vendors and contractors to include minority subcontractors in their proposals. Our solicitation documents outline the requirement that vendors make this, as well as our contracts. This is different than what the city and the state or the county do, as they do have HUB programs. However, as you all know, we are in the middle of a disparity study. So at the end of this year, we will be discussing our purchasing policy and the creation of a HUB program once we learn the results of that disparity study. So this information includes just a little highlight on what eligible expenditures we include in our analysis. We measure participation in these categories: construction, special trade, commodities, professional services, and other services. And then there are quite a few expenditures that are not included in the eligible expenditures, and that does include salaries and benefits and healthcare services. So in FY 2020, we had 11 formal solicitations. The majority of the year, we were focused on transitioning to that remote work environment and supporting the enterprise partners and our community partners in the response to the pandemic. We do use a nationally recognized platform, BidSync, to alert and manage our formal solicitations. And if I may, I will hit on the question that came up in an earlier item about how we let people know. And if you go to our website on the purchasing page, you will see those 2 active solicitations. We currently have an active solicitation for the systems planning services, as well as outreach services.
Wonderful. So they're already on our website, correct?
They're on our website, and they're made available, and alerts do go out to quite a few vendors. You'll see for the 11 proposals, because of this national platform that we use, we can use local, we raise local awareness through emails that we may get from the staff who are needing the services, but we also use this service through BidSync that looks at, you'll see we notified 47,000 subscribers to those 11 proposals last year. I'm happy to talk more offline with anyone who's interested on how that works. We do alert them about the solicitations, and we are trying to provide more robust data to you about how many of those are small businesses or minority or women-owned businesses. And so you will see that for those 11 proposals, 617 reviewed them or looked at them, and then we had 80 submissions. And throughout that alert, review, and submission process, we had between 27 and 42% Hub identified subscribers in that process. 3 of the 10 awards that we had in FY 2020 will have Hub subcontractors assist with performing the work. And I would like to point out kind of the timing issue with some of these things. So the data we're reporting here may not have the expenditures yet. This is just the activity of procuring the contracts. When we talk a little bit later and the numbers Belina will go through, you're going to see different data, which is a look back at what we spent with previous awards. So the timing on this is always just important to know. So I have also shared with the board about the outreach activities, and I'll give you a little bit more information about that as we look forward towards the end of the presentation. But we do continue to have implement that work plan that I shared with you last summer, and we continue to provide updates on. We did not have as many large face-to-face expos this year, as you can imagine, with the pandemic. However, we did attend some before the pandemic, as well as some online. And also, we hosted some virtual environments. Hopefully, many of you saw that we had a community conversation about how to do business with Central Health. We had that on January 28th, and that was specifically to raise awareness about our upcoming construction opportunities and the projects that we'll be having. So we continue to work with the community engagement team and our communications team on social media opportunities and messaging, as well as alerting people through the platforms that we have. So with that, I'm going to introduce Belina and hand it over to her to talk about a little bit more information about the numbers.
Thank you, and welcome, Belina.
Hi, thank you. I'm Belina Bunch, the procurement manager for Central Health. I've been with Central Health since August of last year, and I'm happy to be here. So this slide entails our FY20 informal solicitations, and a little bit about how we do our informal solicitations. We get information from the requesting departments about their specifications and their specific needs. We then obtain a list of vendors that classify with those goods and services that they're needing from the Texas Comptroller's website. And there's a specific place on the Comptroller's website called the Centralized Master Bidding List. So we align the codes of what they need with those vendors, and we send them out emails with the specifications of what's needed, and we request quotes by a certain date and time. When the quotes come in, the purchasing department will evaluate those quotes, making sure that all specs are met, and then pass it on to the department to make sure that they have everything is met that they need. And then we award those solicitations to the lowest bidder. You'll see that in FY20, we did 8 informal solicitations, 2 construction, 4 professional or consulting services, and 2 medical equipment purchases. All 8 solicitations were awarded in FY20, and 1 contract of the 8 was to a hub vendor, which was a woman-owned vendor. FY20's hub numbers look great as a result of our good faith effort, recognizing the 18.75% of total eligible expenses being hub expenditures. We're happy to report 20.32% of eligible operating expenses and 14.38% of eligible capital improvement expenses being awarded to hub vendors. When we look at the historical comparison over the last 9 years, FY20 shows an increase in both operating eligible and hub expenses. And I also want to point out that a significant part of the increase was due to a demolition project on the campus. Putting numbers to the previous chart, you can see that with the exception of FY19, Central Health has been pretty consistent with its hub expenditures. They range from 12 to 20% consistently. So how do we compare to everyone else? Looking at the percentages of hub expenditures for the state, the city, and the county, Central Health holds the top position for FY20, top position in percentage, which is most important. Our dollar amount might not be as much, but we have a good percentage of eligible expenses with hub vendors. And looking at the charts that you're looking at right now, you'll see that we had an eligible $2,637,144,000. Of that, 27.11% was spent with woman-owned businesses. 72.25% was spent with Hispanic, male and female-owned businesses. 0.23% was spent with Black, male and female-owned businesses. And 0.41% was spent with Asian American, male and female-owned businesses. And I'll turn it back over to Lisa.
Thank you, Lisa. I think you're on mute, Lisa. There you go.
Thank you, Belina. So I will just wrap it up with looking forward. You know, we continue to learn from every proposal that we put out there, informal and formal. We take that feedback and we are working on that outreach plan, which I provided the highlight here, but I'm happy to send that out again to the group. As we are working on better data collection, better reporting to you about different milestones throughout the whole process, and working with our partners to raise awareness about how to do business with Central Health. So we will continue to work to raise awareness about the projects we have coming and to try to increase the diversity in the diversity that we're trying to promote with different types of hub vendors. So we're really looking forward to continuing to do that. We have some social media lined up, working with our communications team to make sure people know, especially about the construction projects, which always bring a lot of opportunity for small businesses and subcontractors. And then really, I would really like to just say what an interesting and exciting process it has been working with Colette Holt and Associates on this disparity study. So we have some messaging going out to try to raise awareness about that independent website. I've listed it here, where people can learn about how to give feedback about what it's like to work with us, opportunities for people to learn more about how to do business with Central Health. And we're trying to raise awareness about the disparity study and combine that with our efforts to encourage people to sign up with BidSync with their commodity codes so that when we have these opportunities, they are getting the alerts. It is free to subscribe. There is no cost for them to sign up. And we are, like I said, continuing that outreach and continuing to learn from everything that we do so that we can improve our processes. And with that, I would just like to take this moment to thank our team, Belina, Christina, and Scott. Carol and Misty help on the contracting side, but our procurement team is small, mighty, and growing and great, and I couldn't be more excited to work with them. So I hope the board can appreciate that as well.
Absolutely. Thank you, Lisa. Thank you to the entire team. This is wonderful data. I'm happy to see the progress that we are making and know that there will be more to come with the results that we will get from the disparity study. So thank you very much. Members, any questions, Manager Valadez?
Thank you, Lisa. Again, I'm going to ask whether or not there is going to be breaking down of the proposers, those entities that are trying to submit bids on the female side, on the women-owned business side. Are we going to be able to ascertain whether or not they're Anglo, Black, Latino, whatever, any Asian? Are we going to be able to break it down so that on the women's owned side, we have the same information as we may do on the men's side? Because I thought I understood them to say that it was on the Latino side, it was Hispanic male and female owned businesses.
Yeah.
But
Lisa?
I'm more interested in breaking it down by males and then females, and then make sure that people of color and other I
understand. Let's see. Let's see, Lisa. Do you have? Will you be able to have that kind of demographic data that Manager Valadez is alluding to?
Sure. So I can just tell you and repeat what Belina said, which is our numbers that showed the minority businesses do include males and females who identify themselves with those classifications. But when we do rely, and Manager Valadez, I know we've talked about this, on the certifying agencies. And so there is a women-owned business that if we do not, and we will work with our vendors to collect this, we do ask for it, but the certification is listed by the state as women-owned, and we rely on other certifying agencies as we're not a hub certifying agency. So we can continue to provide additional information if you would like to see of the breakdown for the Hispanic, the Black, and the Asian Pacific vendors. I can get that additional detail. I just thought that might make the pie chart too busy, but we do have, when we receive it and we get the data, we do have a little bit more data on that, and I can.
Thank you.
I appreciate that. Thank you. It was just that when we had this conversation at a previous meeting, no one could tell me whether the entity that was being contracted with, what they were, and I thought that may be a little odd. So.
Thank you. All right.
Thank you.
Members, any other questions at this time? Again, I'm scanning, looking. Please, if I miss somebody else tell me or shout out. Okay, well, thank you very much. Appreciate all the hard work. And with that, there's no motion necessary, so we will move to agenda item number 4, discuss and take appropriate action on an amended cafeteria plan resolution outlining employee benefits. Susan Laura Willers and Lori Oliphant, legal counsel with Winstead Sechrist Dominic, will be presenting. I'll turn it over to them.
Thank you. Thank you, Madam Chair. And good evening, Board of Managers. Susan Laura Willers, Enterprise VP of Human Resources. This agenda item is about Central Health's cafeteria plan. The cafeteria plan is a written document maintained by us at Central Health. It meets the regulations under Section 125 of the IRS Code, which allows us to offer some benefits on a pre-tax basis. This evening, we're requesting that the board adopt the resolution to amend the cafeteria plan. And to tell you more about the plan, I would like to introduce to you Lori Oliphant with the law firm Winstead. Lori?
Thank you.
You're on mute, Lori.
Lori, you're on mute.
I think I was muted, yes. So Susan already mentioned this. The importance of the cafeteria plan is to allow Central to offer its participants the ability to purchase benefits on a pre-tax basis. Without a cafeteria plan, effectively, the participants are supposed to be taxed on the amount of the compensation that they've been set aside to pay for their benefit. So it's very important for us to have a cafeteria plan in place and then amended from time to time to reflect any changes in that design. I started working with Central Health probably at the beginning of 2019 in connection with a change of your flexible spending account vendors and some other health plan changes. And at that time, I had requested a copy of your cafeteria plan, but we were not able to find one. So I have to believe that you were actually operating under one, and perhaps we just can't find the document. So I had prepared a cafeteria plan at that time for adoption by this board. It was submitted to Holly at the time, later in 2019. And I think with the end of the year, and then again at the beginning of 2020 with the pandemic, it kind of got pushed to the side. We want to make sure that we go ahead and adopt that cafeteria plan now. I believe you have received a copy of that cafeteria plan in your board packet. It at this point says an effective date of March 1st, 2019, but we are going to propose that actually be changed to March 1st, 2021, and that this board ratify all actions previously taken based on that cafeteria plan document. So with that, I will open it up for any questions that anyone has about the cafeteria plan or the amendment process.
Members, we've seen the cafeteria plan in your packet. Any questions? Manager Valadez.
Madam Chair, may I go ahead and just move that we adopt Lori Oliphant's suggestion and approve the resolution and ratify all previous actions taken by Central?
Yes, I think the language that you're wanting is the board accept the amended cafeteria plan resolution in the form provided in the board materials, right?
Yes.
Okay, is there a second to that motion? Do I see a second?
Second it.
Manager Bell, so we have a motion from Manager Valadez, thank you, and a second from Manager Bell. All in favor? Aye. Aye.
Aye.
Opposed, same sign. Any abstaining? I'm not seeing any. Please shout out if I miss you. All right, thank you, managers. The motion is approved. Thank you very much.
Thank you.
Thank you.
Thank you, Lori.
Thank you very much, Lori.
Bye-bye.
We will now move to item number 6 on our agenda, receive an update on the findings of the 360 review of the president and CEO. Susan Willers will be presenting along with Diane McNally. Okay, I also am going to read the following items. Item number 7, discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health and enterprise partners, and new developments in eastern Travis County. Item number 8, discuss and take appropriate action on approval of public notice of intention to authorize issuance of certificates of obligation to finance acquisition and construction or renovation of real property. Item number 9, receive a briefing regarding Central Health Enterprise information security issues. And agenda item number 10, receive and discuss an update regarding Sendero Health Plans, Inc., including 2021 ACA enrollment and financial plans. So members, I am now announcing that that the board will be convening in closed session to discuss agenda item 6 under Texas Government Code section 551.074, personnel matters. Agenda item 7 under Texas Government Code section 551.072, deliberation regarding real property, and section 551.071, consultation with attorney. Agenda item 8 under Texas Government Code section 551.072, deliberation regarding real property, and section 551.071, consultation with attorney. Agenda item number 9 under Texas Government Code section 551.071, consultation with attorney, and section 551.0 1.089, deliberation regarding security devices or audits, and agenda item number 10 under Texas Government Code Section 551.085, governing body of certain providers of healthcare services. So members, we now need to completely exit this meeting, and you should have received another link for our closed session, correct, Perla?
Yes, and Chair Greenberg, I also want to just ask that executives hold off on joining until we send a message that your item is up.
Thank you. Okay. Hello. Can you all hear me?
Yeah.
Yes.
You're back. You froze.
Yes, I froze. I know I did. So, Jeff Canodal, which item is it that you're going to?
Is he on yet? Wait, you have to announce us back in.
Yes, okay. I shall do that. The time is now 9:02, and it is 9:02 on Wednesday, March 31st. We are back in open session. We have item number 6, receive and update on the findings of the 360 review of the president and CEO. There is no action necessary on that item. Next is item number 7, discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health, and enterprise partners and new developments in eastern Travis County. Mr. Jeff Canodal, did you have a brief presentation?
Yes, I do. If I could get Lisa to put the presentation up, we will go through it real quick. Thank you so in observance of the hour it's getting, I'm going to go through this quickly. We Central Health have been looking for a couple of years to look for a favorable site for consideration of an administrative consolidation. We feel like over the enterprise being Central Health, Community Care, and Sendero, there was opportunity for us to consolidate all of our administrative offices and to achieve significant savings. That's been a frustrating endeavor. However, we recently have identified a site that seems to check off a lot of the boxes. And so we're requesting the board to consider action to allow us to move forward to negotiate an agreement and also to take advantage of the favorable debt market that currently exists to authorize us to issue or to a resolution of an intent to issue certificates of obligation to finance both that acquisition and also take advantage of the market conditions to finance the construction of the clinics located in Del Valley and Hornsby Bend. So we went through a lot of detailed information in closed session. These are the actions that staff is requesting the board to consider. In addition to a reimbursement resolution, which is a formal resolution that allows Central Health to reimburse itself with any debt proceeds for eligible expenditures related to the cost incurred prior to the issuance of the debt. So next slide. So some of the benefits that we're looking to address was not only not only administrative savings, but we've also identified a site that offers us opportunities to provide multiple clinical services to our patients of both a so-called one-stop shop that we have at a few of our sites in the community care network. We're also looking for improved accessibility related to traffic construction. We wanted to have access to major transit routes. And one of the biggest predicaments at the Central Health side is parking. And so we would be able to solve for sufficient parking space. Next slide. Another category of benefits that we're looking for, as I mentioned, this site that we've identified offers us the ability to utilize significant clinical space for primary care, specialty care, and other ancillary services that will allow us to have that one-stop shop. And then just more efficient utilization of the space as a whole on the administrative side, including non-repetitive space that we lease. Every site that we have for each entity, we have a boardroom, we have a reception area and break room, and having a single site allows us to have more efficient space utilization, more efficiently use the facility services that are required to maintain the facility, and just to have better utilization of productivity time of staff and members that utilize the services. Next slide. And then the last area of benefits that we looked at were just what are the financial benefits, looking at achieving long-term savings versus leasing. And one of the savings that we really looked at was when we lease property, we're actually paying a lease rate that includes property taxes that the owner of the building is having to pay. And so you see down at the bottom, we've taken an estimate of a few of our major sites that we lease across the enterprise, and we've looked at our occupancy of each building and just done an estimated tax cost of those sites, and certainly would think as a government entity, as a tax exempt entity, that we would achieve these type of savings just on pass-through cost. But also keeping in mind the financial benefits, looking at instead of leasing over the long term, actually accumulating an asset that would appreciate over time would be a significant financial benefit that Central Health would want to achieve. And then owning a facility would offer us protection from lease rate inflation. Debt financing provides more stability. The market's favorable, and Central Health has a very high bond rating. We think that it offers us a much better hedge against those lease rate inflation rates that we've seen year over year. Next slide.
Members? Jeff?
Yes.
Can you hear me?
Yeah.
Yes, I can hear you.
Okay, I'm going to keep my video off to see if that helps my internet right now, okay?
Okay.
Okay. This next slide is just a real quick estimate of a preliminary project schedule that we've developed. What it looks at is beginning this tonight, related to coming for consideration of approval for this real estate transaction, and what an estimated timeline would be to complete the project. And so we're looking at an estimate up through the end of 2023. So it looks like it's about 34 months of time related to completion of a project, assuming that we would start today. And again, these are estimates. There are a lot of variables in this project schedule, but just to give both the board and the public a little idea of what we're looking at timeline. This is what we've developed to try to articulate that. Next slide. So this is a financial analysis, just looking at the incremental lease cost, which is on the red line over a 30-year period, and then looking at an acquisition, real estate acquisition that's debt financed, and a renovation that's also debt financed over a 20-year period, and looking at the annual spend over this 30-year period, and where does it cross over to where the lease costs are exceeding the fixed debt service level. And based on this analysis, that occurs at year 11, which leads us to the next slide, which if you look at it from an aggregate standpoint, and you look at lease cost over a 30-year period, you see that the red line trends up, and you see the actual build, the real estate renovation blue line actually starts leveling off in year 20 at the expiration of the debt service payout period. What it tells us over a 30-year period is that we, based on this estimate, that we would expect to achieve approximately $66 million of savings over that 30-year period. And again, just savings to us, savings to Central Health equates to additional resources to provide additional health care. And I think that's an important consideration as we move forward. Next slide. And so the estimated debt service for both the administrative consolidation and additional clinical space and the Del Valley Hornsby Bend clinical sites results in about $5.2 million of annual debt service, which for the average homestead would result in a tax rate increase of $8.65 annually, using the fiscal year 21 property tax rate data that currently exist. Next slide. So this moves into the next item related to the actual certificates of obligation, the intent.
Are you talking about item number 8, discuss and take appropriate action on approval of publication of notice of intention to authorize issuance of certificates of obligation to finance acquisition and construction or renovation of real property?
Yes, thank you, Chair. So this talks about the key events of the actual process. The takeaway from this is kind of twofold. The overall timing of the process is generally going to be 3 to 4 months. And then the second takeaway is that although you, the Central Health Board of Managers, are considering these items, if they are approved, we would still be required to go to the Travis County Commissioners Court for approval of both the real estate transaction and the resolution to publish a notice of intent to issue the certificates of obligation. So I know that was very quick. Thank you for the opportunity. This is a really exciting opportunity. We're still negotiating, and hope that we can bring forward a successful transaction for Central Health. Thank you.
Thank you. Can we stop the screen sharing and go back where I can see everyone? Is that possible?
That is stopped. You're back on the screen share is stopped.
Okay, let me see if I can. Thank you.
Yeah.
Yep, I'm back. Oh, the joys of internet instability. I'm trying to do everything I can to maximize it right now. So thank you very much. Thank you for that excellent presentation and all of the hard work of you and many others on staff, and for providing that information to everyone. Do we have a motion on item number 7, Manager Bell?
On item number 7, I move that the board delegate to the Central Health President and CEO the authority to negotiate and execute an agreement to purchase a site located in Central Austin for enterprise administrative consolidation and clinical space, and to take other actions reasonably necessary to effectuate the purpose of contracting for the property.
I have a motion by Manager Bell. Do we have a second? We have a second by Manager Brinson, yes? Okay. If you can come off mute. So we have a motion and a second. Hearing no discussion, we'll move to vote. All in favor? Aye.
Aye.
Aye, aye, aye. Let me hear you, please.
Aye. Aye.
Manager Valdez, everybody? Okay. Manager Musaitev? Yes? Are we all voting? Thank you. Any opposed, same sign? Any abstaining? Okay, so what I have seen is that there were no abstentions, there was nobody opposed, everyone voted in favor. The motion passes. Thank you very much. Agenda item number 8, do we have a motion on that? Yes, Manager Motwani.
I move that the board adopt the resolution provided to board members requesting the Travis County Commissioners Court to publish notice of intent to issue certificates of obligation to be used for the purchase and renovation of an administrative building and clinical space, in addition to construction of clinics in Hornsby Bend and Del Valley, and authorize the president and CEO to execute reimbursement statements on behalf of the district and any other documents necessary to carry out the purposes of the resolution, including completion of the resolution on behalf of the board to add location information.
Thank you. We have a motion. Do we have a second?
A second.
Okay, so we have a motion by Manager Motwani. We have a second by Manager Brinson. Is there any discussion? Not seeing any. All those in favor, please unmute. Aye.
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 Okay. Opposed? Same sign. Any abstaining? Okay, I'm seeing no abstentions, none opposed, all in favor. So thank you very much, managers. The motion passes. Thank you everyone for your hard work. Appreciate it. We'll now move to item number 9, receive a briefing regarding Central Health Enterprise information security issues. There was no motion necessary no action necessary on this item. So we will now move to item number 10, receive and discuss an update regarding Sendero Health Plans, Inc., including 2021 ACA enrollment and financial updates. There was no action necessary, no motion necessary. So we will move now to agenda item number 11, discuss and take appropriate action on 2021 ACA special open enrollment period, including possible considerations of a request for funding from the Health Alliance for Austin Musicians, open paren, HAM, HAAM, closed paren. Mike Giesland will be presenting, and Central Health staff are available for questions. But managers, I do want to call your attention to the fact that there are, as you know, given our fiduciary responsibility, legal limitations and constraints on expenditures. Central Health is not a grant-making entity. We don't have that authority. Under our enabling statute in the Texas Constitution, our spending must meet 3 key elements to be legal. The predominant purpose of the spending must be for public benefit. The district must receive a clear return on benefit for the spending, and we must maintain sufficient control of the use of funds to ensure that the public purpose is accomplished. That is why grants are not allowed and why the normal course of spending for entities like us is through contracts, where we can use specific and enforceable terms to ensure the public purpose is accomplished or take action against the contractor for failing to meet statutory requirements. In light of these limitations, our consideration of a proposal like the one before us must be carefully crafted to stay within the bounds of constitutional spending limits and provide for controls to protect public funds. And we typically have a process, Mr. Giesland will discuss this, that we go through with requests for proposals and other types of processes. Let me say that we certainly recognize that HAM has been a valuable partner in providing healthcare coverage for the Austin musical community. Just amazing what is being done. And we applaud the efforts of HAM in reaching out to and including musicians of color and of all kinds of musicians who are under-resourced and of various ethnicities in their enrollment efforts. Further, though, staff has just received yesterday afternoon a more detailed proposal from HAM regarding a new idea that they have for outreach, and staff has not had an opportunity to evaluate this new information and to meet and discuss it or to ask HAM follow-up questions. So with that, I will turn it over to Mr. Giesland. Please continue.
Yes, thank you, Madam Chair, and thank you, members. So as the Chair had stated, there's a set of there's a checklist that we go through when we think about these different proposals that come to us from various corners in the community and various organizations. Tonight, it's fairly straightforward, since this is not a staff request or a staff recommendation. It's coming to you from an organization. There needs to be a member that moves and then seconded and then a majority of the vote approving some type of action. The question is, what type of action is that? That could be to instruct management to bring back some type of proposal for maybe a more extended outreach for this fiscal year, or perhaps the next fiscal year, although remember, you can't bind future fiscal years. But nonetheless, you can still consider proposals for future years for ACA related outreach or something that is specific, more specifically targeted within the ACA outreach endeavor. So that's just an example. You need to tell management what it is that you would like us to do with this particular request that's been presented by the organization. I will say, just as for background information, that our communications and outreach team is pushing out information via social media about the extended ACA enrollment period. That includes both social media as well as earned media. Touch Shop and team are also recording video collateral that will, in conjunction with Sendero, that can be pushed out on local media. And then there's an effort underway to identify additional funds for paid media to promote the deadline extension. However, this is not exclusively targeting HAM members. This would be the community at large. So that's just a quick summary of the types of efforts that are currently underway with respect to the extended ACA enrollment period. So with that background information, and again, just looking for a board member to make some motion and then a majority of the board to then adopt that would then instruct management about how to proceed with this. Actually, there is one other point that I'd like to come back to based on what Chair Greenberg was saying. If you do instruct management to take some kind of action with this, because this is the sort of thing that we would put out a bid for and procure through our procurement services, it's that's going to take some time and some resources that we may have to redirect if that is the will of the board to be able to do that. But then it's not a guarantee that that would be awarded to him. They could certainly submit a proposal for in response to some type of request, but again, that would have to be opened up to allow others to submit as well. So with that, that concludes my opening remarks, and we're happy to answer any questions. David, I think you may have some guidance in terms of how the board proceeds with its motions this evening.
I think we also have some other staff here if there are questions. I don't know if any other staff has anything to add, but if so, I'll give them an opportunity. If not, we'll proceed. Okay. All right. I'm not hearing any staff that feels that they need to add any additional information. David, did you have anything to add? David Duncan?
No, ma'am, not okay. Unless, excuse me, not unless I hear that somebody wants to do something and needs some guidance on that.
Okay. Well, perhaps the best course, since staff just got this yesterday afternoon, would be to let staff go back and do, see if there's any more analysis or discussions that need to occur. Kit, I see Kit on here. Kit, did you have anything to add? If you do, fine. If not, fine. Not at this time. Okay, great. All right. Well, members, if there's nothing else, then we will move on to our next item, item number 12. Yes, Manager Valadez. Yes.
Yes, I'd like to make a motion.
Okay.
I'd like to make a motion that because of the timing, due to the Biden administration announcement of expanded dollars to enroll people in the ACA, we knew it was going to last until at least May 15th. Now it's going to go until August. Then I'd like to move that that there be that I would like the Central Health staff to review and negotiate for outreach and enrollment assistance under the ACA to HAM for an amount of $150,000. This is specifically to target the musicians, and especially musicians of color and non-English speakers that would otherwise not have any access to healthcare in Travis County. And as there is a significant timing issue tied to the ACA expansion, I'd like I'd like for us to consider this request and move on it so that we can begin and continue with ACA enrollment. HAM is the only entity that we have contracted with or entered into a partnership with, rather, to provide musicians and musicians of color any access to comprehensive health care. And so in light of the history that Central Health has with HAM for the past many, many, many years, this is not a surprise. This is what they've been doing. I'd like for you all to support it. Thank you. That's my motion.
I'll second that.
There's a motion and a second. Is there discussion, members? Is there any discussion from staff?
Manager Greenberg?
Yes.
I do want to clarify that when we talk about the outreach, there are no premium assistance dollars available for the additional musicians until current musician enrollees go back through the re-enrollment process. And that was part of HAM's proposal. I did have an opportunity to briefly review it. I have not had a chance to talk with executives about what was in the proposal, but we do need to be careful in that the outreach dollars really can only occur once we free up premium assistance dollars based on musicians going through the re-enrollment process.
So we don't currently have premium assistance dollars, and that would have to be freed up through outreach. Also, neither you nor any of the other staff have had a chance to meet and review this and discuss this. Is that correct? Mr. Giesland, yes.
I'm sorry, I'll defer to Kit to answer the question, and then I'd like to ask a clarifying question.
That is correct. We have not had a chance to meet on the proposal that we received yesterday afternoon.
And how this money would be allocated in different ways by HAM and for what costs, and if there's, I don't know, overhead and just various issues that could come into play given our fiduciary responsibility. And as I said, we don't have the power to make grants. Yes, Mr. Giesland.
Well, so my clarification that I'm seeking is on the motion itself, and you'd mentioned grants and not able to do that.
Right.
Is it my understanding that the motion, if it prevails, that the board is instructing us to enter into a contract with HAM? And then I guess my question is, and I need to ask this of council, and is, given the dollar amounts, would that run afoul of any procurement?
Like sole source, exactly. Yeah.
Right. And I don't know if there's other stuff on the line.
I'm not sure if I can even answer that question, because the proposal is so, I won't say uncertain. We don't have enough detail. We don't have enough avenue right now. I don't have enough runway to tell you that it is or is not a certain type of service that could potentially be exempt. So Manager Valadez, what I was going to ask is if I could crystallize your motion a little shorter to say that staff should
go ahead, please help me.
Explore the possibility of contracting and bring it back in April, because we just don't, as Kit said, we've not discussed this with them at all. And we would need to explore whether it is possible to do this in light of the comments that were made by Chair Greenberg. Is this something that for which we can contract without putting it out for bid and letting other people compete for it?
Manager Motwani, I'm sorry, Manager Valadez. I think Manager Motwani had his hand up. Manager Motwani, did I see a hand?
Yes, I was curious if we had any sense of what HAM staff and executive staff thoughts might be around it, or what their expectations might have been coming into the evening around action that we might take. And I know that I guess we don't that's what I'm wondering.
They're here. I believe that Rachel Blair and Renee Collins, who are the executives with HAM, are here.
So
I'd like to hear from them then.
Yes, and Manager Motwani, maybe you can direct your question to them.
Thank you.
I see them on the screen now.
Yeah. Hi, Ms. Collins and Ms. Blair. I am curious about, especially given the context of the motion that's being discussed, what maybe y'all's expectations were coming into the evening. Of course, given what I'm hearing from Central Health staff, that there hasn't been sufficient time to have reviewed the proposal and have discussed it. What maybe were y'all's expectations or hopes coming in, and maybe see what daylight there may be, and we may be able to calibrate that or reduce that daylight and crystallize maybe the motion in a way that shows a good faith movement forward.
Well, I think I don't know that we necessarily had expectations. This is an unusual circumstance, and I think certainly what has happened with the special enrollment period and ACA and all the things that have gone on, we have tried to be really flexible and come up with solutions and trying to meet needs. I hear very clearly the concerns, and we appreciate our relationship with Central Health very much. I'm sorry, I'm plugging in my computer because it's just about to die. We want to be good partners. And so I think I guess I would say that I'm feeling a little bit like we have, we might have stepped up norm with doing this, maybe because we were trying to respond and react to the great need that's going on in the short time frames around this special enrollment period. And the only thing that I would say that I know for sure is that our partnership has been very good, and that we have been very, very successful in getting people and getting musicians that are low income, vulnerable populations to get access to healthcare or to move and do things that they needed to do. But again, I don't know that I had expectations. We just wanted to try to do the right thing if we could make a difference.
Chair, if I might continue, then would it be reasonable notion that perhaps y'all, meaning Ham, go back and given the strong, very clear sentiment behind Manager Valadez's motion around uniquely focusing on non-English speakers and the populations that she specifically identified, at least conceptually scaffold things out without great cost risk, such that it may be coupled with any substantial discussion that would occur at the meeting, and we may be able to hit the ground running if and when action were to be taken then, while sort of, honoring the intent of Manager Valadez's motion. Does that sound like we've heard enough of that intent? And then I would also pose, Chair, that question to Manager Valadez, if that would sound honors the intent.
Madam Chair, if you'll let me respond to
yes,
Manager Motwani. I've tried to get this on the agenda for a couple of months now and have been cut off. I understand that there has been issues with weather and other things, but this is not a new item. We have been working with Ham for years after years after years, including when I myself have been asking the question of, what are we doing for the women musicians? What are we doing for the people of color musicians? What are we doing for the people who don't speak English musicians? And I found that they have, in my opinion, which is sometimes very difficult to get me to change my mind, I gave them a chance. I gave them a chance this past year, and I did. They have performed magnificently in light of everything that they are having to deal with, in light of COVID, in light of this, in light of being able to meet with people in person. They have gone above and beyond the call of duty. This is not a secret. This is not a backroom deal. They have been very forthcoming in their need to come forward and to help us enroll more people from Travis County who don't have access to healthcare, who are low income, who have behavioral needs, mental health needs. And I'm just amazed that we cannot take action on this today, and that we can't have something worked out between Central Health for them to be able to do outreach and enroll, help with
it. Manager Valadez, Manager Valadez, Manager Valadez. This is not about the great value that they have brought, which is this is an amazing partnership, and we have continued and will continue to work with them. But this has, my understanding from staff, this changed from last month. My understanding from staff is this changed just yesterday when they received this yesterday afternoon. I don't know legally what we can and cannot or how do it right now. And so Mr. Giesland, do you have any suggestions right now, or Mr. Duncan, on a resolution that could give us what we need for staff to go back and actually look at this and see what could be done within the legal constraints that we operate in?
Just a clarifying question.
Yes.
Rachel and Rini, have you all submitted something to Central Health yesterday that you have not previously submitted?
Yes.
Did you all submit something to him yesterday that you did not previously?
Yesterday afternoon, is that correct, Kit?
Sorry. Yes, we were aware of the $150,000 request. We had a phone call with Rini and Rachel on Monday afternoon, letting them know we would need more specifics on how the money would be spent, that we could not accept a general request for $150,000. And then yesterday afternoon, Rini did submit to us some more bucketed information. So there were kind of 3 high-level buckets of how they would spend dollars. That was received late in the afternoon. I was able to review it, but Perla, other executives, the team has not been able to meet and evaluate the proposal like we would normally do any proposal that we have received. And yes, HAM has been an incredible partner. We've worked for them for many years. I think that the challenge is we're transitioning into a new phase. We have never contracted directly with HAM. This has been a partnership because of the mutual benefits to their member population receiving access to healthcare and us being able to ensure that they could afford it. And so, and Rainey has shared with me, I mean, we're going to continue to work together. They are going to continue to outreach to their musicians. It's just, it's a lot of work. And so I understand their request for additional funding. It is just out of our norm, and we just have not had a chance to vet it as a staff and kind of really work through what a proposal would look like.
Manager Valadez, yes.
Madam Chair, then if I could restate my motion.
Of course.
To make it something very, I guess, more clear and safer, is I move that that Central Health staff review and work and negotiate with HAM on the proposal and come back to us as soon as possible with a recommended action so that they will be immediately ready to begin doing outreach and enrollment assistance upon approval.
Okay, I'm gonna have to turn to our lawyer. I am not a lawyer, to David Duncan.
That strikes me. I was actually looking to see, I think Mike just disappeared on me.
He may have bad internet like I was having tonight.
He may. I will say that strikes me as a motion, just to summarize again, it strikes me as a motion to direct us to work and see if we can make, evaluate and see if we can make this work. Let me just,
that is correct. I just would like Dr. Samota to second it, second the modification, if that's okay.
I second.
Okay.
And there you have it. Now we have a motion and a second.
Yeah, let's give a minute to see if Mike comes back. My internet was unstable. I got bounced. You all probably saw a couple times tonight. That's probably what happened with him, but
Mike and I got, we're at the office and we got kicked out of.
You got kicked out.
Central.
I got kicked out twice tonight.
I had to join by telephone.
Yeah, it happened to me earlier tonight. You all probably saw it twice. I got kicked off. Okay, so Pearl is back. Mike, are you back? No.
He may call, see if he can dial in.
Oh, wait, Mike just texted me. The internet crashed. Oh, yes. I understand. It crashed at Cesar Chavez. He's rejoining. Yeah, mine crashed twice tonight. Who knows what's going on? Let's just give him 1 minute, see if he can hop back on by phone or something. He said it's back and he's trying to rejoin. Mike, are you here by phone? Give him a minute. Mike, yes. So no worries. You probably noticed mine crashed tonight twice. I think I was bumped off twice. Okay. So there was a discussion. Manager Valadez reframed her motion to have staff go back and work with HAM and report back as soon as possible. Am I paraphrasing that correctly, Manager Valadez?
Yes, to review and negotiate their proposal to Central Health.
And there was a second by Manager Zamora, correct? And
Correct.
David, do you have a summary of that motion since we?
That was a very accurate summary in my estimation.
So we have then a motion and a second.
So just to make sure that I understand,
yes,
this is something that the board desires that we negotiate directly with Ham on this.
Well, the motion was to
review and negotiate with Ham on the proposal they have submitted to Central Health. Very clear.
Okay.
What?
This is Jeff. I thought I heard in the motion to bring back a recommendation.
Yes, sir.
Yes. You're right. You're right.
Okay, well, that's completely different. So that needs to be real clear.
You're right. David, can you read a motion for us, please? That's why I was wanting you to do this, David, please.
Direct the staff to evaluate the Ham proposal, determine if a legally compliant agreement can be reached, and bring any recommendation back to the board
for action.
Is that, Mike, does that capture what you need? And Jeff, does that capture what you need?
I think what I have written down is Central Health staff would review and negotiate with Ham a proposal and bring back a recommendation to the Central Health Board for action.
Jeff, I'm going to say what you have is similar, but David had to put it in legal language.
It doesn't have to be in legal language. That's plenty good. And direction-wise, Mike, you're the boss. Is that enough direction for you to give your staff tasks to do?
Yes, it is.
Thank you.
Thank you, Jeff. Thank you, David.
Okay, I have to admit, I'm confused. We need one motion. We had David Duncan wording and we had Jeff Canota wording. We can only have one. This much I do know.
Okay.
Can you read that one again, Jeff?
Yeah, direct Central Health staff to review and negotiate a proposal and bring back a recommendation to the Central Health Board for outreach assistance.
No.
It was for outreach and enrollment assistance.
Okay.
And there was wording in there about recommendation, and David, you had something in there about legal compliance. So we need to roll all this together.
Chair?
Yes.
I hate to belabor this, and I just wanted to make sure the intent of what Manager Valadez has said and all of the important components are all together. And I did hear something also about such that work could activate immediately, or such, that.
Well, that would be part of the recommendation, I think.
Right. Okay.
So let's make an attempt to roll this all together, please.
Give me about 30 seconds. It helps me if I type things.
I understand. I don't want one of the, I want a substitute bill here with it all rolled into one.
Where's the gavel, Sherry? You need the gavel.
A committee substitute. That was the term I was looking for. Let's roll it all into one committee substitute.
He looks intent.
Unfortunately, it has multiple concepts, and how you divide it is difficult. So sorry, it's taking me a little longer than I thought.
You just do what you need to. We're just going to sit here patiently. Manager Saitis, yes.
Yes, thank you. I concur with Manager Valadez. We all want to provide care, and definitely during these unprecedented times. There is no doubt that we all concur and want this to move forward. My concern is right now is the motion on the floor. We're going back and forth. I want to make sure that we vetted this motion correctly, and I'm not sure if right now is the right time.
Well, that's what David Duncan, our counsel, is working on, is putting the language all into one so we can vet it. That's what he's working on right now.
Let me try this. Direct staff to review the proposal submitted by hand and evaluate the viability of entering into an agreement to implement the proposal that is legally compliant, and bring a recommendation back to the Central Health Board as soon as possible.
That seems to have the components.
I like that.
Okay. So Manager
Okay,
Valadez, do you move that?
I move that.
And Manager Zamora said he likes that. Is that a second, Manager Zamora?
That's a second.
Okay, we have a motion and a second. Do we have any further discussion?
Call for the question.
Okay, no further discussion. So we will take a vote. All in favor of the motion, signify by saying aye.
Aye.
Aye. Opposed? Any abstaining? One abstaining? Okay, so did we capture everyone? Okay. Members, we will now move to item number 12.
Thank you.
Confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is scheduled for Wednesday, April 28, 2021 at 5 p.m. or immediately following the Executive Committee meeting at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702, and/or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. At this time, I'm ready to accept a motion for adjournment.
Move to adjourn.
There's a motion to adjournment. Is there a second? Manager Valadez moved.
Second.
Second from Manager Bell. All in favor say aye.
Aye.
Opposed, same sign. Members, thank you for your time and attention, and to all the staff and to all members of the public.
God bless you all.
Thank you.